Welcome to Feed Your Mind Wellness. I'm Dr. Sandi Scheinbaum, and it's my great pleasure to welcome Marian Tompson today. She's best known as the founder of Leche International, which she was the president of for 24 years. She is truly the high priestess of breastfeeding mothers. She has co-authored the book, The Womanly Art of Breastfeeding, which has been a bestseller. She has traveled the world. She is widely published in scientific journals. And most importantly, she's the wife of the late Tom Tompson, mother of 7, grandmother of 17, and now great-grandmother of 9. Marian, welcome today.
Thank you, Sandi.
Marian has written a wonderful book called Passionate Journey. And I was all set to read this book on a plane over the weekend. And I was just about to open it up, and a young mother sat down with her baby. And of course my first thought was, oh no, how much reading am I going to get done with the baby next to me? And the mother proceeded to breastfeed. And I thought, this is really more than coincidence.
Yeah.
And we had a great conversation, and what she said to me was, this is so easy because I don't need any gear. You know, look around me. I don't have to take much stuff. It's just me. And I just can take me with my baby, and it's very easy. But breastfeeding wasn't always easy, and you were a real pioneer at a time when a mother couldn't have gotten on an airplane and proceeded to breastfeed her baby. So can you tell us a little bit about that time when you were giving birth to your first children? You were in the hospital and it wasn't real pleasant.
Well, I wanted to breastfeed because I had had a natural birth, and I felt the best thing I could do for my baby then was nurse. But nobody knew anything about breastfeeding in the hospital. They gave me no advice, never told me simple basic things like if I was worried about if I had enough milk, the more the baby nursed, the more milk I would have. I didn't have any idea that there was a connection with that time. And of course, you never went out in public to breastfeed. Even when I visited relatives, I would spend the whole visit in the bedroom alone because the newborn wanted to nurse all the time, and so I wasn't part of the family conversations. They might be okay with you nursing, but they didn't want to see it. They didn't want it to be part of what was going on in life. And I also found when I had a question, a baby who spit up, the answer usually was, because the baby spit up, I should give some extra formula so that to make sure the baby was getting enough food. And in those days, giving formula was like a hazmat idea. You couldn't touch anything by hand. You had to use tongs, you had to use rubber gloves, you had to sterilize the bottles. I mean, it was just so much work and really difficult to do when you were trying to breastfeed at the same time. So it wasn't until I had my 4th baby that I actually met a doctor whose wife had breastfed and who herself had come through problems for years but finally had it figured out. And so she helped me with my 4th baby, and I nursed that baby until she weaned herself at 13 months. And around that time, we both happened to be at a picnic, a church picnic with our babies and our families. And women we knew, but didn't know how they fed their babies, came up to us and started talking about how they wanted to breastfeed their babies. But they had the same problems Mary and I had. And so it just seemed unfair to me that women who wanted to do the best for their babies couldn't get any help. And so we decided what we would do was just offer our own experiences to women who were wanting to breastfeed and help them along.
This is truly the best type of healthcare because it's from the ground up. It's based on the community, not on some expert, so-called expert, telling you what is best.
Right, and plus it's coming from experienced women. We live what we talk.
Yes.
So, and even now, I mean, women, recommend that they come to the Leche meetings before their baby is born. Even though they won't remember a lot of things, because usually when you're pregnant, you're more concerned about getting through the delivery, okay? But you'll be around women who are a community of breastfeeding women, and you'll begin to feel perfectly natural about it. You don't have to defend it. You'll see how other people just handle their babies and handle nursing. And they do give you preparation for the hospital, because different hospitals have different systems set up, so you usually can get help with how to deal with that system.
We are so fortunate to have a very special audience today. And these are some babies and their moms who have come here to meet Marian. Well, we have a lot of special guests in our audience today who have joined us to talk with Marian. I want to welcome our babies, baby Grayson, baby Eli, baby Penny, and baby Yosef. What would you like to ask Marian today?
I was just curious, because now he's 3 months, and I've been doing the on-demand feeding, and lately that's quite demanding. It'll be even more than once an hour at times, and often every hour on the hour. And I'm really open to it, and I'm at home. But I'm just curious if there's any reason to try to push it to 2 hours, or try to get on more of a schedule, or if it's really, because if it's really beneficial for it to just go by his cue alone, I'm willing to do that. I'm just kind of curious about it.
He's a Scorpio. It looks like Eli's about 3 months old, right? Well, you might be surprised to know that it's pretty typical around 3 months for a baby to start nursing very often, very frequently, to build up your milk supply. They just need to get over the hump and bring in a greater supply, because you know the more the baby sucks, the more milk you have. But that's very typical, and I know the first time I went through it, I thought something was wrong with me, but everything's right with what he's doing.
Okay, so it does eventually kind of settle into a little bit.
Oh, absolutely. He will, and as he gets older, it'll get more into almost a schedule that you can, count on.
Okay,
but
just naturally.
All right, well, I have a question.
Sure.
For my baby Yossi, he's 3 weeks, just turned, and I had read some articles about when you're breastfeeding to try not to give him, a bottle or pacifiers or things to detour him from the breast milk. So in that, I've really just only given him breast, and he does like to suck, and even the doctor said that he was sucking his thumb in the ultrasound. And so I was wondering, he has feedings, and I could tell they're feedings because they're long, extended, and he's really latched on when I look at his face. But then other times, it's a couple minutes, or he's just falling asleep. It's not really a feeding, I don't think. And so I don't know if he's using my nipple as a pacifier, and if that's a bad thing, or what I should maybe do differently.
It's really a good thing. I mean, it's a good thing because it's something that he'll grow out of so much easier than often when children are given pacifiers, and they'll have to have them for a couple of years, going on. But it's very normal to do that non-nutritive nursing as you're falling off to sleep. So he's, that's a very normal, natural part of nursing for a baby. And inserting something else, the only reason I would ever find that you might think about doing it, if he starts bringing in more milk and he doesn't want more milk, he's full. And in that situation, you might use a pacifier for him to suck on, but otherwise, no, I wouldn't.
I have a question. When babies spit up, he doesn't spit up all the time, but he does spit up. Do you think that means that he'll want to nurse, but then he'll spit up, and he'll nurse in cluster feedings and yada yada. And do you think that him spitting up is a sign that I'm doing that too much, that I'm feeding him too much, or do you think?
They spit up for a number of reasons, and some of it is getting air in when they're nursing, and if your milk is coming too fast at that moment. But how old is Grayson?
He's 11 weeks Monday.
11 weeks, okay, so he's more of an age where he can cope with milk coming in. But so it could be air that he's getting in with the milk, or you might have to stop and just bubble him for a while, to bring up any kind of bubble that's interfering with them.
Right.
But otherwise, you know, that's probably perfectly fine.
First of all, how do you deal with teeth? When I haven't read about this, so I'm just curious.
Teeth aren't involved in sucking.
So
I mean, when you suck from a straw or something, you don't bite down on it.
Naturally just
Right, but sucking at the breast is very different. It's involving more the jaw, really, than teeth, which is why children have better developed jaws and are less likely to have orthodontia problems.
Well, and another question, solid foods. How long, like when would you suggest introducing solid foods?
Well, usually all the studies back up what Leche was saying from the beginning, to nurse exclusively for the first 6 months.
Mm-hmm.
Once you start adding other foods, that baby isn't getting all the breast milk he should get.
Right.
So after 6 months, you can start with other foods. Some babies who are highly sensitive and allergic won't start solids, don't even want them for 8, 9 months or a year, and yet they're perfectly healthy babies when their doctors, you know, take a look at them. The great thing about breast milk is your baby is getting the best possible food, so they're not going to have the digestion problems other babies would have. But sometimes, you know, they will have a problem with gas, and sometimes it can be something the mother's eating that she doesn't realize really isn't good for her too. There was a study done in Japan where they found babies with allergy problems, when they started taking the mothers off of different foods to find out what was coming through the milk, they found that when they discovered the culprit in the food and the mother stopped eating it, the problem she had that she never even thought had anything to do with her food went away too. So the baby is also a barometer of you being your own baby.
Okay. I know this is beyond the scope of La Leche per se, but I'm sure you've been interested in things to do with babies and everything for your whole life. So
yes.
I'm just curious about, you know, I've done a lot of reading about attachment parenting, and Laura introduced me to a wonderful book, The Continuum Concept.
Oh, I love that book.
Yeah, I just was curious about your ideas and thoughts around all of that, and just
I am totally, well, it was two Leche leaders who started attachment parenting, and it really is the natural, normal way to bring up babies.
Yeah.
I mean, the baby's needs are the same, even though we might decide we want to live differently, or women are sort of forced or sort of shamed into doing something else because instead of just staying with their baby. And the effects that you see coming out of it. Now, I've got great-grandchildren, and to me, one of the most gratifying things is seeing how my grandchildren are raising their children and looking at the family dynamics and the love that's going, you know, nobody's...
It's like it's intensifying.
Yes, it does. I mean, and it's almost like become genetic, I think. They wouldn't even think of, you know, raising their children any other way.
Maybe. Yeah.
And they're happy and the children are happy.
That's beautiful.
So I don't think you can go wrong. Sometimes you have to stand up to people who think you're wrong. But the benefits last your whole life.
Yeah, that's beautiful. What would you recommend, for example, when one is attachment parenting, and you know, sometimes I actually will go pee with him, you know, while I'm holding him, because he absolutely is not having any part of
I'm sure he
down
isn't.
or, you know.
I mean, that's life. I mean, there's always going to be little things that come up that you're going to find difficult to do. So I really think you get back from what you give in the long run with your family.
Yeah.
So you were saying that giving the baby your breast to help soothe them instead of a pacifier per se. Do you think that I could possibly run into problems with that when, say, like my husband is watching her and he can't obviously, you know, soothe her in that way? Do you think that that could possibly create more of a struggle for him to soothe her? Because he'll have to give her a bottle.
If a pacifier is something she gets used to, that would cause a struggle because she wouldn't be getting it. But there are some people who have found that it helped to use it, that use certain parameters, like they never give it to the baby and lay the baby down. They only use it when somebody's holding the baby. So, so they don't start to get detached from that whole idea of having to go through life with that pacifier stuck in their mouth, which, you know,
Yeah.
you do see that sort of a lot.
Yeah.
Well, these have been wonderful questions. Thank you. Thank you, babies.
Thank you.